will you do me a favor and take a look at it in a little bit and just make sure that you're able to see it on the Zoom, right? All right. So hi, my name is Kathleen King, and what we're going to talk about is heart disease and heart health. And I just want to point out that this is 90% preventable, and yet it is the #1 leading cause of death since 1950. So in the United States, the leading cause of death since 1950 is heart disease, and it's 90% preventable. So if that's not mind-blowing, it's a little mind-blowing to me. So I'm Kathleen King. I do have a business called Reliable RN. I have no financial disclosures to report for this, but my goal is not about giving specific medical advice, but instead to provide additional knowledge and clarification so you can have more meaningful discussions with your doctor or your wellness team. We are also live in addition to the Zoom, so I'm going to let people interrupt if they have questions. We're just going to, work with it as we're going. So that way we don't have to hold questions. So the first thing I wanted to point out is just what our heart looks like. So for your page 3 or page 2 at the top. So the normal heart is the picture to your left side, right? So basically has 4 chambers, 2 tops, 2 bottoms. The tops are called the atrium. The bottoms are called ventricles. And the one on the left is what we consider like a normal looking heart. The one on the right is, they say, a hypertrophic left ventricle. That thickening wall is what happens for a lot of people when they have high blood pressure for an extended period of time that's not corrected. So we call high blood pressure like the silent killer, and it's because over time it's remodeling your heart. So when you don't control it, it's not going to kill you tomorrow, but boy, when your heart starts to look like the left-hand side, you have a problem. And at that point, not so correctable. So on the bottom side, it says your heart's the primary organ of your circulatory system. It pumps blood throughout your body. And I like people to think about it a little bit like a house, right? It has walls, rooms, doors, plumbing, and electrical, right? The parts of your heart all work together. And what we're really going to be talking about separately is the electrical, the plumbing, and the structure. So the walls, doors, kind of things like that, okay? So electrical, those are impulses. They set the rate and regularity, right? Your heart, is it regular? Does it beat like it should with, like the beat to a song, okay? Plumbing, how the blood flows. That's our valves and vessels. And then structure, that's your cardiac muscles, the pump, like how effective is the pump of the heart, and the performance. So cardiac muscles, pump, and performance would be under structure. So the first one I was going to talk about is electrical. So there is what we call an intrinsic rate, right? So your heart has this intrinsic rate, and that's set by the SA node, this sinoatrial node. So it's up in the atrium. And that is set to beat between 60 and 100 beats a minute, right? That's what most people would know as a regular heart rate. However, if there's an interruption, the SA node is supposed to run to the AV node, and then it goes down and around the bottom part of your heart. If something's up with the SA node, or there's a short circuit, right, or a loose wire, right, or a cut wire that's kind of, not getting right, what happens sometimes is other parts of the heart try to take control, like the AV node. So then the atrium, the top part, might be not beating out of sync with the bottom. And that's a problem, right? So and the important ions for our electrical system is potassium and magnesium. So those are the big, that's why we care about your potassium numbers when we're looking at your blood work, and magnesium is another one. When those values are off, often we get irregular heart rhythms because the electricity is not going the way it should be.
So potassium in a banana once a day, worthy of, is that?
So that's very possible, but believe it or not, it depends. It's different for everybody. So my mom all of a sudden I saw her blood work and I'm like, why is your potassium so high? And she said, I don't know. And I said, are you eating a banana a day? And she said, I am. Like, stop that. Right? Like, you have to go to every other, you have to have half a banana, mom, because your potassium numbers are through the roof.
My dad, 89, has a banana every day. And they will tell you, if you don't bring them home, he's gonna call you and make sure you go back out to the store. So I was just wondering if that is, so I don't know until
could
we
be-
see his.
It could be a very good thing. And one way to check, so go on, does he have a My Chart?
Yes,
And do you have access to it?
yeah.
So check his potassium level.
Oh, okay.
If it's right in the normal range, he's probably doing exactly the right thing. If it looks low or high, you might have to adjust how much banana. But yes, banana is a typical thing we use to keep
And
potassium.
magnesium out of the standard diet.
It is in foods, and usually everybody does get enough of it. Normally, when we see magnesium off, it's usually in the setting of an emergency room and something has happened. There's been an illness or something else that's caused it to be low.
Oh, okay.
And we replace it with a one-time dose IV. And we never have a problem again, because it's usually in the setting of illness or a cardiac event
Okay.
that it decreases.
I had SCT, inflation.
Oh, yeah, right. Yeah, I know, but it seems miraculous now, doesn't it?
Yeah.
That you can just do that, right? All right, so plumbing. Plumbing,
So question
yeah, sure.
With the SVT,
Mhm.
so it's not necessarily the SA node. Why would it be S?
We're gonna get there.
Okay.
I know, I was gonna say, we'll work with the irregularities in a minute. How about that, okay?
Perfect.
All right, so this is your standard plumbing. The important thing here is, so the left side that we color red, this is a very traditional thing that we do. It doesn't look anything like this. This is the picture. The left side's gonna have extra oxygen, the oxygen that's coming back from our lungs. The right side is gonna look blue. That's the stuff coming back from our body. There's a right atrium, but I want you to notice the valve. Tricuspid valve is on the right side between the atrium and the ventricle. And on the left side is a mitral valve on the left, between the atrium and the ventricle. Those valves over time can become sticky or less elastic. So a mitral valve replacement is a pretty standard thing that we do as people age, and it's really important. We don't want blood leaking from the ventricle back into the atrium or from the right ventricle back into the right atrium. So blood needs to flow in the correct direction, and there are tests to see whether or not those valves are working the way they're supposed to. And then the last one, the structure piece. So if you notice, I kind of did this. We have the small box that is up close of the wall. So on the outside is adipose tissue, right? So that's fat. We do have a layer of fat on our heart, but imagine if that layer is really thick, right? Are you gonna get a balloon to pump as efficiently if it's surrounded by a very thick layer of fat? Probably not. And visceral fat, that's that fat that's from like our neck to our torso. The roundy body, the apple shape, that's what we know is not okay anymore. That we're really trying, visceral fat is the fat that we want to try to eliminate more than anything, because it starts to surround our organs. It also, we have the pericardium there, the epicardium, the myocardium, the endocardium. And if you can imagine, some of you have probably heard the term myocarditis. Pericarditis. Carditis just means inflammation. So when those areas get inflamed,
Okay.
they're swollen. How well do you work on a swollen ankle? Not very well. Your heart doesn't work very well when it's swollen, right? Same kind of deal. So that's what we're talking about when I talk about the structure, kind of the wall.
And how will those get swollen by?
Sometimes it's viral.
Okay.
Usually it's viral, but sometimes it's injury. But injury can be lack of oxygen or electricity firing erratically for too long. Any of those can kind of irritate the linings. So
Because one of my friends has a defibrillator
Mhm,
in her heart.
mhm.
Now, is that because apparently was a viral. and
It
they-
might have damaged the heart
Mhm.
enough that they are concerned that there's at least a chance that it would stop beating on its own. So by putting the defibrillator in place, it's basically like a portable AED,
Mhm.
an internal one. So it will, they feel very confident that if it did that even once, she'd probably be fine because it would come right back. It still means a trip to the hospital. It still means somebody check it out afterwards. But yes, it means at some point there was either damage, it could be viral, like I said, or sometimes it's congenital, and they just discover it. And luckily they discovered it before a major incident. So this next one, on the next page, we're talking about different tests to check the functions of the heart. So most of you, the upper left-hand side is a EKG. I think most people have probably had an EKG in their life. The middle one is a stress test, and that's a standing stress test. That's like when they ask you to, you're going to run or walk. As you get older or you're less mobile, they might do a stress test where you still lay on a table and they actually inject a medicine that will make your heart mimic running on a treadmill. And that way they can still get the result. I know my mom actually is mobile, but there's no way she could, because of her back, run on a treadmill enough to get her there. So she did that other type of test. Far right is blood pressure. You have well, it's so funny. People underestimate like the value of blood pressure, and yet everybody would know, no matter where you go, one of the first things they do is take your blood pressure.
Mhm.
It's because you can glean that much information from a blood pressure, whether it's standing, sitting, laying down. You really can tell an awful lot about current function with a blood pressure cuff. So there's a reason we take it all the time. On the bottom left-hand side is a cardiac catheterization. Those can be done for diagnostic reasons or for fixing something. So a lot of times they want to use that as their diagnostic tool because while they're there, they can fix the problem. Whereas if you're on a stress test and you see there's a problem, guess what they're scheduling tomorrow? A cardiac cath, right? So a catheterization, sometimes they're saying, okay, can we just skip that step and use this as the diagnosis, the diagnostic tool, because then we can fix it while we're in there if we see something that we're worried about. So sometimes they will do that.
Pretty invasive.
It is, but it is definitely more definitive than a stress test.
Right.
You can have a positive stress test and be fine. I mean, but they're
Right.
gonna have to go in anyway at that
Right.
point. So you're like, oh, so. And then on the bottom right is an echocardiogram. So a lot of times from echocardiogram, one, we can see those valves we were talking about. You can see if blood is leaking backwards. You can see how thick the wall is on the heart. So sometimes that's going to tell you that. And also that one of the things they get from it is what we call an EF, an ejection fraction. So it tells the quality of the pump of the heart, which is fantastic because that tells you an awful lot about the strength of that forceful pump. And that's going to, because when people have lower body edema, sometimes it's not dependent. It sometimes is because the pump of the heart is not where it needs to be. And there are medications that can help that. And then I listed some blood work. Troponin. Troponin is an element that gets released only when cardiac tissue is damaged. So when you go to the hospital and you've had chest pain, they're always going to run troponins. That number doesn't peak until about 12 to 18 hours after, I have pain. But in a 24-hour cycle, they're going to be quickly able to tell whether any cardiac tissue was damaged or not, whether it's from a virus or
Just when
cardiac
you're doing
attack.
a blood check.
Yes.
Wow.
Yep. They can totally, because it's only released from cardiac tissue, nothing else.
Okay.
BNP is a tool we use. It's a blood test that will tell us for somebody in heart failure whether there's too much fluid in their whole body. So BNP helps us to know if their heart failure if they're in trouble with heart failure, too much fluid on board, we might try to give them Lasix or something. And then again, potassium and magnesium, we're always going to check those.
What's tachycardia?
Beating too fast, tachy, anything that's TA, like
Okay.
TAC, like, so if you're tachypnic, you're
Mhm.
breathing too fast. If tachycardia, your heart's beating too fast.
And is that detrimental to your?
Not if you're,
Oh,
not if you're a runner and you're running the road race. But if you're sitting at home in bed, probably not good. There's some reason. If you have a fever, you're often tachycardic, right? Your body's trying to fix itself.
Because my daughter-in-law has tachycardia and she had to, they were trying to find
Why?
where she needed to have the ablation or.
Right. So again, so probably an electrical problem, something, so somebody,
Yep.
like the SA node who's supposed to control the rate was being overridden by some other electrical wire.
Okay.
And they fight over, I mean, like, I don't know how else to describe it, but
Mm.
it's like electrical pieces fighting to take control of the heart. And the heart muscle, it's going to respond to any electrical signal, right? So it's like boom, boom, boom. So it starts getting fast. It could get slow. It just depends on where the extra electricity is coming from. And that's why they have to find, because they don't want to kill off other sections. They only want to kill off the section that's causing the problem.
Yeah, and every time they go in, that problem spot stopped giving the problem.
Right.
So she was trying to have an ablation like a million times.
Oh,
and
that's
So I
horrible.
just,
Yeah.
I don't get the whole thing, but thank you for the.
No problem. And so what's normal? So normal is blood pressure 100 to 129 over 70 to 90. So if your blood pressure is 129 over 89, they're pretty happy. 90, they might start getting unhappy. They might want you to medicate. So there's different medications for the diastolic, the low side of your blood pressure, the 70. So if you're, 129 over 100, you'd say, well, isn't that good? No, that 100 is a problem because one is when your heart's beating and the other is when it's resting. So if it's not resting when it's supposed to rest, it's not filling with blood. If it doesn't fill with blood, that when it pushes everything, you're not getting enough blood everywhere. So both numbers matter, and there's different things they can do for different problems. In general, lower blood pressure is fine. Nobody's going to care about it unless you're symptomatic. If every time I stand up, I get so dizzy, I want to fall over, then my low blood pressure is a problem, right? But I have honestly driven home from the hospital with a blood pressure of 84 over 45, and people are like, I think you're dead. I'm like, no, I'm really tired. And they're like, please go eat something.
So if
Okay.
they are, somebody that gets dizzy or whatever, so do they give you medicine to bring your pressure?
Believe it or not,
or-
sometimes to bring pressure up. So the first thing you do to bring pressure up is honestly, those are the people who don't have salt restrictions. It's like all of a sudden potato chips are perfectly fine for you.
Okay.
You might get compression socks because that'll help. You want to drink a ton of water, right? Because water matters.
Mhm.
And so you want pressure, you want extra fluid in your vessels,
okay.
right? Think of it as like
Okay.
turning a hose on, right? You
Mhm.
want to turn the hose on more. Generally, a heart rate should be 60 to 100. When you're sleeping, it could be much lower, right? We're sleeping, it's okay. A runner, somebody who is an avid runner, has for their whole life, their resting heartbeat might be 45. That's great. We don't mind that. And it's faster with activity. So if you're in a Zumba class and you get up to 140, 150, good for you. So you're working hard. Yay. So we like that. Your rhythm. So rhythm should be regular. We always say, so when we say irregular, it's when you beat. So that's an atrial fibrillation, like that, typically that kind of beat. Sometimes it's some other stuff that's benign, but they're going to need to check it out. Ejection fraction we talked about. Believe it or not, 65% or greater is usually pretty wonderful. Nobody's going to worry about it. It's not like it's supposed to be 100%. So if they came out and said, oh, your EF is 70%, some people would be like, oh, just 70, like, is that a problem? It's not a problem. The problem is when it's 25. That's a problem.
It's between 15 and 20.
Yeah, and there's not much they can do about it. Right. So my son had a myopericarditis at 20 and his got down to 25%. Yeah. But luckily it was short term, but again, and it was myopericarditis. So he had inflammation everywhere. Um, and so he was meant to rest his heart, which is kind of tough to do. It's not like staying off it for an ankle, but there's nothing like telling a 20-year-old that like for the next 6 months, you can't do anything cardiac. Like you can't walk up a flight of stairs. You have to take the elevator at school. You can't.
Oh,
And
God.
if you can imagine, for a 20-year-old, there's also one other thing that you have to tell him he can't do. And he didn't like hearing that either. Little to no swelling in the feet or legs upon waking. So what's normal is when you wake up, you should be able to see your ankles. And they should look like ankles, not like swollen, tree trunks. So if there's no injury, your ankle, you should be able to see your ankle bones. Now, if during the day they get swollen, that's really not unusual as we get older. That sometimes just has to do with valves in your vessels. But it's certainly something to check out. But in the morning, you shouldn't have swollen feet. That could be a sign of heart failure. All right, so now we're getting to all the diseases. And this is why it's the #1 killer, because there's a ton of diseases that it could have, right? So if we start at 1 o'clock, it's valve disease, right? So they're showing what stenosis looks like versus a closed valve. If you have stenosis and it's severe enough, they are going to want to replace the valve. There are mechanical valves, there are bovine, so pig valves that sometimes they use. And there's, it's a pretty standard procedure these days, not a lot of big issues with it generally. An aneurysm at 3 o'clock, if you see it says an aneurysm, a thoracic aortic aneurysm, notice the vessel is bulging. So that's kind of an issue. Aneurysms are not that easy to fix and they're not that easy to find. And unfortunately, a lot of aneurysms are found post deceased, right? Because it's an aneurysm, because it just bursts, right? Now, if they happen to see it on an echo, or you happen to have some symptoms, they could go in, but that's probably going to be an open heart surgery kind of thing. They're going to probably replace that because there's not much they can do to reinforce it. We can open a vessel pretty easily, but we really can't close it back up. We can't go on the outside and close it up. We can kind of open it from the inside.
Yeah.
At 5 o'clock is what you were talking about, cardiac arrhythmias. So this is disorganized electrical signals. And yes, a lot of times they can use a cardioversion sometimes to do that. So we literally shock the heart at the exact time that it would stop, which is actually what happened to Damar Hamlin. Most likely the hit happened at the exact moment and it stopped the heart. And it didn't restart. When we do it,
He was hit at the exact moment his heart was at rest.
it's not just rest. There is this moment in time, and it's funny when you have an arrhythmia and somebody's going to do a cardioversion, you hook them up, and there's a certain setting on the AED, so it registers exactly when you can push that button to stop the heart. When you stop it there, and it'll restart in 30 or 60 seconds, and everybody stands there going hoping it restarts, right? But we know it will, so it's okay. But a half a millisecond before that, or if you shocked on the wrong timing, you could stop the heart and it wouldn't restart. And so they think that's really what happened. They think that's what happened to him, is it was just a timing thing. Yeah, it wasn't because all of their padding is supposed to have impact for these hits. But yeah. But anyway, so there's two things. You can do that cardioversion or an ablation, where we actually kill off some of the electrical cords. You're going to stop them from firing because you don't want them to fire anymore. But this is new. This is I would say mid-90s is when that started to become mid-1990s. So it's not like it's been around forever. Cardiomyopathy, we talked about that on the very first slide. If you look at 6 o'clock, cardiomyopathy, that's where the right side or the left side, I'm sorry, where all of that good blood is actually so small. Look how small it is. It's not feeding your systems enough. You're not getting enough oxygenated blood everywhere it's supposed to go. And remember, our oxygenated blood is how our cells get fed and also how we pull waste away. So something's going to give here. This is when we start to maybe see kidney failure. You know, like something down the line is going to be affected by this. And this is often caused by uncontrolled hypertension, high blood pressure. Pericarditis at 7 o'clock. That's the inflamed pericardium. And again, you could have myopericarditis, you could have myocarditis, you could have endocarditis. It's just inflammation. Imagine that heart trying to beat like normal, given the surrounding, it's like trying to beat underwater, it's just not the same. At 9 o'clock is heart failure. So heart failure, now look at this, it's actually too thin. See the dilated ventricle? It's actually too thin. So you have just the same problem. It doesn't have enough cardiac muscle to effectively beat. And you can't grow. I mean, believe it or not, the heart is the only place where you actually can repair scar tissue. It can repair its own scar tissue. It can grow new. It's amazing. The cells are amazing in the heart. They really are. But for heart failure patients, it's really hard. And it tends to become a disease that you can control, but long-term becomes progressive. It makes, it just over time, it's hard.
My mom's getting ready to celebrate 6 years since her massive heart attack. She has heart failure,
Yeah.
diabetes, oxygen, 20.
Yeah.
So I don't think
But for 6 years, that's pretty impressive though. For 6 years, that's,
yeah.
All right. And then 11 o'clock, coronary artery disease. So this is why cholesterol matters. CAD, coronary artery disease. A lot of people have this. It's a buildup of plaque, like the stuff on your teeth, inside your vessels. And another piece of this that people I don't think completely understand, if a piece of that plaque gets dislodged as blood's flowing through, it's like having, a stone traveling through your blood system. And one of the big places it goes is your brain. And the vessels in our brain are tiny. So it lodges and that causes a stroke. That's an embolic stroke, which is 85% of our strokes are blockages.
all of these things are just triggering thoughts and memories of friends and
Yeah. So they can, we can control coronary artery disease. We can control by controlling our cholesterol, by taking, cholesterol medication, by not drinking every night. There's lots of great ways to control it, but in some cases, yes.
Well, there's like 5 people in our family, like cousins included. We all have high cholesterol, it's just over normal, but it's like, I don't have salt, I don't. Everybody, my doctor said, just forget about it. Don't worry about it. We're going to keep our eye on it, but it has nothing really to do with your eating habits as much as you think it does. But it's just
Right, but
hereditary.
so the other thing about cholesterol is if your HDL, if your good cholesterol is driving your number high, that's okay, because that's the good cholesterol.
Right. Which I don't understand why there's good and bad.
So I will tell you, I have a great webinar on my website that just talks about cholesterol, and it'll explain how they come up with the number, the 200 number, and that'll help you to understand the good and the bad and the triglycerides, right? Because it's actually a calculated number for cholesterol. But anyway, but if you are high and it's because of the bad type of cholesterol, there's a brand new study that just came out in the last 2 or 3 months that basically is stating that cholesterol medication does have a significant role in decreasing cardiac disease and risk of heart attack. And so I do like people to reconsider if they need medication, it might be worth doing. A lot of people don't want to take medication. I support that to a point. If you can't bring it down yourselves, it's time for medication. Give yourself 6 months or a set time and There you go. All right, so heart diseases and treatments. Trying to keep an eye on time here. So common treatments, statins, this is the cholesterol lowering drugs we just talked about. And see, it can lower the risk of a heart attack by up to 25%. That's a brand new study that just came out. Beta blockers. We use those to bring down blood pressure. And it says heart rate, but more importantly, it increases the pump of your heart. It actually makes it more efficient, right? So if you can imagine, if you're in that EF range of 30 or 40, it might help you get to a 40 or 50, 45 or a 50. So blood thinners. Sometimes we take the blood thinners for people who have those arrhythmias. And the reason is when you have an arrhythmia, even if it's controlled with rate, you have the potential to form clots at the base of the ventricles. And if you form a clot and it gets sucked up into the vessels and it goes to your brain, we're back to stroke, right? So we're careful about that. And then lifestyle changes. Of course, a lot of people discount how significant minor lifestyle changes can be. And I put on the right-hand side here, cardiac catheterization. Again, that's a treatment. That can be a treatment. A TAVR is what they're called. And a lot of people have had this for aortic valve replacement, transcatheter aortic valve replacement, and ablation or cardioversion for atrial fibrillation or other electrical disturbances. And
lifestyle changes. Are you going to get to that?
I am. I promise I'll get there. I know I really will. I will. 12 possible heart symptoms never to ignore. Anxiety, believe it or not, anxiety is a big component. So there's a difference between, so what I'm going to talk about here are heart symptoms not to ignore, but you could probably call the primary care doctor, maybe get a same-day appointment. Signs of a heart attack are chest pain. I feel like an elephant's on my chest. For a woman, it might be I'm nauseous, pain down your side. But, I'll tell this story. So my father-in-law, now he was obese and he had asthma, and they lived on the second floor apartment after they sold their house. And for a month or two, as my mother-in-law would describe, it got like continually harder for him to like get up the stairs without like huffing and puffing. So he assumed it was his asthma or his obesity. And he had a massive heart attack at Foxwoods and died. And it was only in retrospect that she went, oh, well, he was having trouble going up the stairs. If you are more short of breath doing an activity than you have been forever, you should call your primary care. Like, it's worth getting it checked out, because it might not be pulmonary. It might not be a cold. It could be something more serious. And either way, you shouldn't be huffing and puffing if you're coming in from the car to put your groceries down, if you haven't had that same problem a month ago. Something's changed. So don't ignore changes like that. Sweating, right? You carry your groceries in from the car and you are sweating. Like, really? Were you having that much trouble carrying them a month ago or a week ago? And if not, it's time to see your doctor. They'll probably do an EKG. They might do some blood work, and they might say, "Ooh, you know what? You probably should see a cardiologist," or maybe they'll put a monitor on you for a month and see if there's any odd things going on with your heart. Clearly, the next slide is heart attack warning signs, and this is a 911 call. Please do not take yourself to the hospital. And don't feel bad if it ends up being nothing. Because if you have these warning signs, we want you to call 911. Everybody wants you to call 911. The emergency room wants you to come in by ambulance, please.
Well, sometimes the ambulance will take care of something right then that, in the 5 or 10 minutes it takes you to get to the.
Absolutely. The first thing they're going to give you is they're going to give you a baby aspirin. They might put oxygen on you, which will decrease the demand on your lungs to get enough oxygen into the bloodstream, right? So what they do right away actually does help to minimize the effect if there's something going on. And it doesn't have any real serious side effects if there's nothing going on.
Right.
It's not going to kill you if you just chewed 4 baby aspirin when you're not having a heart attack. You're going to be okay. So anything. And again, anxiety and sleep disorder. If you are woken up from a sound sleep because you have chest pain. Yeah, the idea is not to try to go back to sleep. Yeah, like that's not the plan. It should be a call. Okay. And all right, managing heart health. I knew we'd get here. See, we're getting here. Okay, so for people, the funny thing is about this, I happen to use two different sites for managing heart disease for managing stuff with heart disease or without, but honestly, it's almost exactly the same. Preventing it or managing a healthy heart is almost the same as what people have to do with heart disease. If we would all just adopt some of these, you can stop a lot of this. So if you have heart disease, you do need to know your family history, because exactly what you're saying, if high cholesterol runs in the family, high blood pressure runs in my husband's family at a young age. So all of my their pediatrician had it flagged in their chart. And now as they moved on to adult doctors, it's flagged everywhere, because it didn't matter if they ate well, they ran, he was running marathons and still needed blood pressure medication. It's just hereditary. Start it early, because again, I don't want their heart to be remodeled. Eat a healthy diet. So when we talk about small changes, right? If you don't eat a vegetable at every meal, try to add a fruit or a vegetable to every meal. That's a big deal. Like, just create a new habit. If you can't walk 30 minutes a day, walk 10 minutes a day, 3 times. If you're not, if you struggle with, you watch TV too long, when a commercial comes on, purposely go walk somewhere else and come back. Right? Like, move, just move. We all have this image that what we have to do. Somebody said when I started this business, are you going to convince people to be vegan and to be all organic and natural? And I'm like, yeah, I just want them to drink more water and less soda. Like, could we start there? If they want to take it to vegan, I will help them do that. But, I just quit diet soda. I'm a recovering diet Coke addict for about 1.5 years. And I still feel drawn to it every time I see the can. But little things, it takes a long time to create a habit. One habit leads to a new habit, leads to a different habit, leads to, when I first got off Diet Coke, I had to have seltzer. Okay, well, but now I'm okay with regular water. Sometimes I make tea, but not caffeinated. Wow. Small changes do matter, and over time they will create habits that make you one step closer to being healthy, increasing your wellness.
I'm, in the process, as every day you're trying to do something better for yourself. So, my dad drinks V8. He likes orange juice, it's bothering his stomach, so now he drinks the V8, the vegetable juice. So it's very good. It's got a lot of nutrients for him. So I was buying the V8, strawberry banana or whatever. Are those actually, it says, this is 2 servings of vegetables and fruit. Is that real?
So the serving of vegetable and fruit is real.
No, but I mean, in that beverage.
So in that beverage, if you look, the sugar is probably high.
Yeah.
Right. So the sugar is not great. In the regular V8, the salt is
okay.
really not great.
Sodium ones.
That's helpful.
Okay.
That is helpful. V8 and tomato juice is good for a lot of our seniors. But to be honest, for my guy who has low blood pressure, I'm always pushing the V8 because it's so high in sodium.
Oh, okay.
So you always have to be careful. The American Heart Association would say that the number one problem they see with most adults and diet is that our sodium intake is wildly too high. It's bacon, it's cut sandwich meats, it's sausage, it's our breakfast foods, it's sodium. People will say, well, I don't add salt to anything. It's
already in there.
Everything.
Yeah.
It's really, it's endemic in prepared foods. It's endemic. Salt does increase flavor. There's a reason we like it. But there are ways around it, and generally it's other flavor things like garlic, becoming heavier in garlic, cumin or turmeric. If you're going to do hot, like a chili thing, you go spicy kind of thing. Garlic, onion, green peppers, red pepper, those kind of things help to add flavor, because what we're looking for is flavor, right? That's what we're looking for. It's not so much the salt, but we want flavor. So quit smoking. This is a standard for everybody. Take medication as prescribed. So this is a big deal. I talk to people about this a lot. If you don't want to take medication, be honest with your doctor and say, I'm not going to take this medication. And come up with a plan. Or you start taking the medication, you have side effects, tell them, even if you want to stop. If people want to stop medication, it's within your right to stop medication. Tell your doctors. Because the other thing is, if you change your medications and you don't update your doctor or update your MyChart, if you end up in the hospital for something,
They think you're still.
they think you're still taking them, and they're going to start giving them all to you. And that could cause a whole nother series of problems if you haven't been taking them. So just share. Taking medications as prescribed, though, especially for blood pressure people, is really important. And I can't tell you how many blood pressure people say to me, well, I don't take it anymore because I don't really have high blood pressure. I'm like, that's because you were taking your med. Right, but that's how people, but they think about it and they're like, yeah, but no, it's normal. Every time I go in now, it's normal. I'm like, I know. I keep taking the medications. Same with cholesterol. Oh, my cholesterol is normal. I know. It's because you take Lipitor. Anyway, choose your drinks wisely. This is more around sodas and alcohol. Those high sugary drinks and too much alcohol. One of the big issues coming out of COVID, believe it or not, was everybody's triglycerides were through the roof. And triglycerides, which affect your cholesterol number. And it's a fat that kind of rolls through your veins. And, you know, people would say, yeah, but I didn't feel like I got out for more walks. I did that. You know, like, I really didn't, it didn't change my routine or even my diet that much. I'm like, okay, did you start having more drinks? And like, oh yeah, we did have a cocktail every night, like one, sometimes two. And I'm like, and before, when you couldn't stay home and you had to go to work, did you have a cocktail every night or two? And they're like, okay. So, okay, back it up. Alcohol is a big driver of triglycerides. So yeah, it is. And
Wow.
I was going to say how often, right? Monitor your
Every night or whatever. I think it had.
Usually it's because, so it's a high sugar. Most alcohols are a high sugar. So you just don't think about it, but that's the very thing that's, causing it to ferment. It's the sugar. It feeds the yeast. All right. And monitor your blood pressure at home. I actually say this to everybody. Honestly, anybody over the age of 50 should have a blood pressure cuff at home. Take it, once or twice a week, probably the same time, or take it, morning and before bed or something. When you go into your doctor, it's much better for you to show a doctor what your blood pressure is at home than for them to take it there, because when they take it, you might have white coat syndrome. It might be higher because, you're nervous or you're stressed. I'm always just like, it takes me, I'm running into the doctor's office because I had 1,000 things to do. And they're like, your blood pressure is really high. I'm like, can we take it again at the end? Because then I will be breathing and, so yeah, right. But if it's at home, if it's normal at home, then you don't necessarily need medication, but they need to see that and you should monitor it.
To tell us the proper way, because my husband thinks, you put it on, you can just sit, you have to have your arm above your heart or something.
He's right. He's right.
Matt?
Not enough.
Okay.
Not enough, because we're just looking for gross numbers. We're just looking for, like if it was nice and low and all of a sudden it's really high, or if it's trending up through the year. Generally you don't want to do it with your arm up here,
Right.
and then the next day with it down here.
Okay, so just be consistent.
They do, right. I was going to say they do like it to be about even with your heart. So if it's laying on a table, that's usually the best. But there are some that you do on your wrist. And to be honest, the wrist ones are supposed to be on this hand and you hold it here. That's different than the ones that go on here. So they all have directions. So you could try that. So now on the right side, for all those without heart disease, if you look, it's almost the same list, right? Be more physically active, follow a healthy heart diet, limit salt, healthy weight. If you're overweight, don't try to take off 20, 30, 40 pounds. Try to take off 5. You know, there's a great CDC poster. If people would just decrease 300 calories a day, if every American did 300, we would save 57 million cases of cardiac disease. 300 calories a day, just decrease 300 calories.
Yeah.
Now, that means we can't have chocolate though. So
No,
we
it means you can have chocolate
Mhm.
as long as you didn't have spaghetti with dinner. You see, it's all
Yeah.
about what you choose.
Yeah.
Like, give up, so your spaghetti serving gets small, so I can have chocolate later. I choose dark chocolate because it's got less sugar and it's better for you. Exactly. There you go. And you control conditions like diabetes, cholesterol, or blood pressure. Again, choose your drinks wisely. Manage stress. Oh, that should be on both sides. Managing stress is huge. Take yoga, practice breathing. Honestly, even once an hour, 30 seconds. There's a million apps. In through your nose, out through your mouth, 30 seconds, and restart, right? That learning how to control the stress in your world is huge. And that's actually probably one of the big drivers as, compared to 1950. In 1950, we had heart disease because people were just not healthy, right? Like we just didn't know what we didn't know. Now we know. And stress is a big driver now of heart disease because we are a highly stressful nation. And I just like this one. And this even says an hour a day. Nobody's actually even asking you for an hour a day. They're saying in a week's time, if you can get 2.5 to 3 hours of good physical activity, you're golden. That actually it ticks most of the boxes. That's a half hour to 45 minutes a day. Or, today I'm going to do an hour. Tomorrow I'll just do my 20-minute walk. The next day I might play tennis for an hour and a half. Think about it in a week's time, right? But every day you got to be moving at least 20 minutes. Whether it's a walk, whether it's, cleaning is for all of us who clean. Let me tell you, making a bunch of beds and cleaning gets you pretty much done. Right. So I'm about to lose. This is too funny. I'm going to lose my thing. And then you have resources to help you. And then the last thing is my available services, what I do. And I'm going to stop sharing and I'm actually going to stop recording because if my computer dies, I want us to be okay. So I know.